बेटा इधर
Good evening to each and everyone over here. I am thrilled to welcome you all for today's career webinar on MediCareer Masterclass, career growth and clinical upskilling for doctors. I am Vijay, manager at Mediversal Academy, and I have the privilege of introducing our esteemed speaker for the day, Dr. Navonil Dutta. Dr. Navonil has been done MBBS in FIC DNB pulmonology, now currently pursuing. He is working since 2020, served in the frontline critical care during COVID pandemic, teaching, moderating, and conducting seminars since 2022. He is part of West Bengal Rheumatology Association and are very regular to their CMEs and seminars organized across the country. During MBBS, he was a part of SAMSA, which is South Asian Medical Student Association from 2017 to 2021. In 2019, he was awarded with the Best Poster Case Presentation at the International Undergraduate Conference, Conscience 2019 in JIPMER Pondicherry. Before we over to you, Dr. Namonil. Doctor, you can try unmuting yourself now.
Yeah.
Thank you.
Good evening, Vijay sir. Good evening to the entire team of Mediversal, and good evening to all the guests and doctors who are present here today. I hope you're all doing well as we step into the final month of this year, as we embark on the prospects of a new year. I hope you're all hale and hearty. I hope your families are doing well, and I hope you're happy wherever you are, because I think profits and losses, wins, failures, everything on one side, but being happy, I think, is something that is often less talked of. So I really hope you are doing well. And what is this exactly? Is the meeting in progress? I think there's something which happened.
Yeah. Now is that clear? Now I was.
Yeah. It's clear. Yeah. Okay. So I hope you're doing hale and hearty. And so today's webinar, unlike all my other webinars where I would usually talk of cases, where I would talk of medical education, some insights, some topics related to critical care, pulmonology, medicine in general. This is a different sort of a webinar. This is a different sort of a project that we have embarked on. And I'd be wanting to have a very interactive session. I know most of my webinars are already very interactive, but this is going to be super interactive. It's going to be more than what you've usually come across. And I would want your wholehearted participation in it, because that is something that will help all of us, including you, me, and every one of us, grow together. So before I begin something, I think there is how many? I think we have a good amount of around 59, 60 participants. Yeah, 60 participants. Yeah. So I just want to know from the first few people, or no, you can keep typing on your chat boxes. This is going to be a heavily interactive interview. I mean, a webinar. I want to know from all of you as to which places you belong to, number one. Number two is, what are you currently pursuing? I mean, I'm very sure there are some very young doctors present here, some very senior doctors, with all due respect, and some who have been maybe just pursuing their MBBS, Ayush, or BAMS courses. Some of them who are wanting to start their practice after completion of their graduation courses, after the completion of their professional courses. I would exactly want to know what is the pool of students that I'm having. How many of you have completed MBBS? If you can let me know in the first place, then we'll talk about BAMS, then we'll talk about the other segments. From Bangalore, completed PUMS. Okay, that's great. Medical officer, okay, from Odisha. Teaching diploma level to lab, BMLT. That's very good. That's a new thing. I mean, a new pattern, a new guest that we have here. Ajit, okay. So are you pursuing MBBS? For people writing MBBS, just write to me whether you're pursuing MBBS or you've completed MBBS. That is something that will be helping me. Pathologist, thank you. MBBS MD Physiology, welcome, Dr. Vishal sir. BAMS Kerala, Dr. Akshita, that's nice. Nice to know you. I'm waiting for more replies because I will curate the webinar accordingly in the next few minutes. BAMS doctor, okay. MBBS working as a JR, okay, that's nice. So many people from Assam. It's one of the best states of this country, the Northeast entirely. MBBS completed. Okay, that's lovely. Completed BAMS. We're having a lot of people who have completed BAMS, who are pursuing BAMS. That's lovely. What about the others? I want every one of you to participate. Completed my MBBS. Okay, MBBS completed. Okay. Hi, Dr. Vikas. Good evening, Twinkle. Nice to always have you in the webinars. Hi, Dr. Vikas. Yeah. I'm wishing to hear from everyone who's come into this wonderful wintry evening. I think it's chilly out there, no matter which part of the country you are in. And I hope you're all doing well. So yeah, I would want to know which stage of your career you are in. 2 more minutes, and then we'll gather it up from there. Anyone else left to share your insights? Anyone else wishing to write? Almost 33, 34 responses that I've got. Sonologist, that's lovely. Dr. Madhumat, if I think Madhumati, if that is the correct name that I'm pronouncing. Yes, Dr. Madhumati, welcome. Multi-speciality Ayurveda, that's lovely. Dr. Nafisa from Bangalore completed BAMS. Okay. Okay. I'm waiting to read your responses. Completed your MBBS and Masters in Skin Aesthetics. That's lovely. That's lovely. Okay. Someone's from Ahmedabad. What are you currently doing there? What are you doing? We're having a good pool of doctors from BMS. Quite a decent pool from the MBBS. Okay, I guess we are good to begin now. Okay, so today's evening, as I have said, it's unlike most other webinars where I try to teach and share medical updates, medical learning. This is more of a, I won't say mentorship. I think that's too grave a word to use. Creates a lot of divide between me sitting here and you on the other side of the screen. Let's say it's an opportunity to explore uh, what our new year is having, explore the different options that we have in the upcoming days, the upcoming months. Try to make 2026, if not more, but at least as productive as 2025 was for us. And if 2025 was not a year that was up to the mark for most people, including me, so we would love to make it better. We would love to take a step forward, and we would love to, make sure that we are at a place where we can not just upskill ourselves as human beings, doctors, but also upskill our knowledge. And that is exactly where, and the reason why we have all come together today on this evening. So, to all the people who are, you know, who have responded here to me, the ones who have completed their BAMS, the ones who are pursuing BAMS, as well as the ones who are pursuing MBBS or completed their MBBS. A couple of them, I think, have completed their masters as well. One of them in physiology, the other one, I think, in skin aesthetics. Some of them working as medical officers. So, what are we trying to exactly do from here? We are trying to explore what are the other niches that we can discover. Okay, MD anatomy. We have MD anatomy here. Dr. Arshia, lovely to have you. So we're trying to explore what's ahead. We're trying to explore what else we can do. Uh, like just if I take the example of Dr. Arshia, who has just been the last one to respond to the chat. So she's completed her MD in anatomy, and if I talk of anatomy as a subject, she has basically an area where she can explore as in teaching in medical colleges, being an associate professor, being an assistant professor, or later in the years, God willing, becoming an HOD of a department. But then that is through the medical education system. But what if she does not want to teach? What if she wants to work as a clinician? MD anatomy, will someone who has pursued MD anatomy and cleared MD anatomy not be allowed to work as a clinician? Definitely not. She can work as a clinician. And how so? Can she join an ICU? Can she join any private or a corporate setup? Can she join in the hospital as a clinician, not as someone who is pursuing anatomy for that matter? Or even if it's anatomy, how further can she take on her journey of teaching anatomy to students and making it a better place, a better world, so that she is deemed as someone different compared to what the others in her department are. And that is exactly what we are wanting to look at. We are wanting to upskill each of our own selves, including me. We're all wanting to make ourselves one step ahead, one step better, not than our peers, but one step better than what we were doing till yesterday. It's just becoming a better version of ourselves in the upcoming days. So, as I was saying, that for someone who's completed their MBBS, I know that most of you must have appeared for your NEET PG examinations or your AIMS PG examinations, the INICT as it is popularly known as. And some of you, I'm very sure, must have gotten wonderful ranks, and you would be taking up your counseling seats and pursuing your residency in whichever branch or subject you want to. Then comes the other set of people who for some reason did not get a desired rank, or maybe got a very good rank, but they're not able to get a desired subject in that rank, because we know the amount of competition, the amount of rat race that is there in this in this world of postgraduate entrances. I think we all are very aware of the amount of burden, the amount of rat race, the amount of commotion, chaos that is present in the system. And it is very it is very evident that someone who's got a decent rank but not ending up with his or her subject of choice is bound to feel demotivated, is bound to feel whether they are enough, bound to feel the fact that whether I'm good enough for this profession, or how to see myself in the upcoming months. Of course, one option is giving a NEET PG again, and but am I really motivated enough? Am I really good enough to think that okay, I can appear in the PG exams again and come out with flying colors and come out with the branch or subject that I want to choose. It's about providing an emotional, a mental, and also a very realistic ground where we are wanting to make sure that all of you, all of the people who have not done very well or well according to what you would have wanted in your respective entrance examinations, you are good enough to think that yes, if you have made it till here, if you have made it till the point where you are right now, completed your MBBS, some of you are working as medical officers, some of you have been preparing your hearts out. It's just to let you know that if you have made it till here, then trust me, you're good enough. Because there's there's a very little saying that I keep telling to my colleagues and juniors, that with due respect to all other professions, I think this one profession, the profession of medicine, the profession of being in the medical field, it is a profession that chooses you much more than you choosing the profession. And I've always believed in this, that just like the theory of evolution, where it is always the survival of the fittest, the ones who are surviving, the ones, all of us, including you, me, every one of us, who are surviving right now in this field, it's only because we have been good enough to survive in this field. We have been capable enough to survive in this field, which is why I think it's a theory of natural selection, which has selected this pool of people. So the ones who have given your PG entrance exams, who have given your FMG screening exams, or the MCI screening exams as it is popularly known as, and you are kind of wondering whether you are in the right zone, whether you have the ability to make it. Trust me, you have it, dear. Trust me. And it just needs one push, one one moment for you to decide that yes, you have the power to change everything. And as a very popular saying goes, that this is not how my story will end. No, you have every single time, each one of you, the ones from MBBS, the ones from BMS, the ones the ones who are pursuing any other career in this medical field, the ones who is a sonologist, who's a lab technician, the pathologist, each one of us, I believe, there's a learner, there's a student in each one of us, no matter what age group we belong to, no matter what place in this country we belong to, or what place on this earth we belong to. I think there's a learner, there's a student in each one of us. And there's a good student, there's a sincere student in each one of us, which is why we have made it till here. Just a few days back, I was having a talk with a sonologist. I think there's someone from Chennai, if I'm not very wrong, here who commented that she happens to be a sonologist, and I think Dr. Madhumati, if I'm not mistaking the name, you can correct me. Uh, so I was having a talk with a sonologist just a few days back regarding a few investigations that I did for my mother. And there's so much that I learned from the person. There's so much that I learned regarding the cases that he gets. He also happened to be from Chennai. So what I'm saying is, unlike or contrary to the belief where we always have felt that doctors are the ones who will be teaching everyone else, we as doctors, we have learned a lot from technicians. We have learned a lot from the sonologists. We have learned things, the technical aspect of things, the nitty gritties of things from 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 the ones we have worked with. And whenever we talk of solving a case successfully, it is these people whom we also talk of, because they are actually a huge workforce behind all of us. Maybe we are the ones who are seen, but the ones who are behind us, from the lab technicians to the pathologists, drug controllers, to the you know the ones who are controlling in the infection control department, each one of us has an equal contribution, if not more, in trying to make sure that we can discharge a patient well, hale and hearty. So it's now up to you all, it's now up to us all, to be honest, that we decide that is this where we want to stop, is this where we want to end, is this how we want to be, or should we upskill ourselves, or should we make a step forward in trying to make ourselves a better person, a better technician, knowing things better. Because I can promise you this, for a sonologist or for a lab technician or a pathologist who's working all these years, the nitty gritties, the details, the finesse that is required in operating the machines, right? For example, for a sonologist, uh, they are pretty well aware as to how to do a pure tone audiometry. They're pretty well aware as to how to do a tympanometry. They're pretty well aware of how to do an electrocochleography. They're also aware of the diseases that they can pick up on the reports. But they're probably not very aware of the pathophysiology of the disease. Once they are aware of the technical aspects of their own work, now you all have become a pro at your work. Now is the time when you start filtering and reassessing yourselves, trying to add a new layer, trying to add a new layer of, or an additional layer of information to the existing knowledge that you have. For example, can I have a heads up from the sonologist who is there, Dr. Madhumati, if you're here, if you're hearing me, can I have a heads up from you? Can I have a hi from you? I'll be trying to talk to each one of you. Trust me. This is going to be a very, very interactive session. Can we have you on the camera? I mean, or on the microphone, whatever you're comfortable with. Vijay sir, can we arrange for that? Srinivas sir, Vijay sir, can we bring Dr. Madhumati on the mic or the camera if she wants? Madhumati, are you comfortable with being on the camera, or are you comfortable with being on the microphone? Anything that you're comfortable with, Dr. Madhumati. Srinivas sir, Vijay sir, if you can do that. Vijay sir, am I audible? I think there's some issues. Uh, just a moment. Let me just try connecting.
Sorry, doctor.
Yeah. Vijay sir, are you available? Can
Yes,
we
yes,
can we
I'm
bring
here.
yeah can we bring in Madhumita on the camera, because
Yeah, I'll
she
do one thing. I will make cam. Yeah.
Madhumita, can we have a little talk with you, if you don't
Yes,
mind?
please. Yeah, Dr. Madhumata, you can switch on your camera on as well as, yeah, you can unmute yourself.
Hi, good evening, everyone.
Hi, good evening, Madhumita. How are you?
Yeah, fine, sir.
Okay. So I read from your chats, and thank you for participating, that you happen to be a sonologist, right? So where are you
Yes,
currently
sir.
working, Madhumita? Where are you currently working in?
I'm at Chennai, sir,
You're
working
in
with
Chennai.
a radiologist in a Sri Chakra teams.
Fantastic,
Under a
fantastic. So
radiologist, I'm working as a sonologist.
fantastic. Okay. So you're working as a sonologist, and can you tell me what are the things that you would usually, encounter in your practice? What are the general cases that you encounter?
We usually encounter renal cases. Renal calculi, most commonly, we are going to diagnose it. And then obstetrics, we are handling obstetrics, regular obstetrics for screening. Each and every obstetrics we are doing, and the gynecology cases. All the
Fantastic.
gynecology cases for mostly for PCOD problems, and then each and every uterine fibroids, and then every discussion, and then with
So
the mammogram also.
fantastic. So as much as I can understand, you are very well versed with ultrasound. You're very well
Yes,
versed
sir.
with picking up the usual diseases that we can pick up on ultrasound, like something like seeing the gallbladder physiology pathologies, something like the liver pathologies,
Yes, sir. Each
something
and
like
everything. Each and
yeah. We can check out whether the ovaries are doing well in a female who is probably not having her regular menses. In the pregnancy period, we can in the entire intrapartum period, we can keep the monitoring for the both the mother as well as the fetus. Am I right, Dr. Madhumati? Is that the work that we are doing? Correct. Correct. So anytime you see a case of PCOD, or you see a case of say an anomaly on the ultrasound, are you able to, I'm very sure your eyes would lit up when you find a pathology, and you would be telling the doctor, that
yes, sir.
look
Sure.
look
Yeah.
look for the kidneys, look for the heart.
Yes, sir. Sure. We are doing
Yes.
it for the maternal and then fetal also.
Perfect. So we all can hear
And
from
I'm supposed
Madhumati
to
that
inform with the referral also.
absolutely. So we can
We
hear
will
from
pick up
from
the
from Madhumati.
anomalies and then we will show.
Absolutely. So we can hear from Madhumati that she is in a place which is a very sensitive branch, right? And we can really associate the amount of importance that her skill and her knowledge, her her working finesse is going to bring to this profession, because she's exactly in care of the mother who has entered a new phase of her life, right? She's in care of intrapartum surveillance of the fetus, of the mother, and she's trying to look out for genetic anomalies in the fetus. She's trying to look out for anomalies in the mother during the entire, 9 months or 40 weeks of gestation. So you can understand the amount of finesse that she has earned. I mean, it just might seem a very little probe with a transducer, but believe me, it is a real difficult job. It's not as easy as it sounds. And for everyone who goes to the obstetrician or to the radiologist to get an ultrasound done, it might just seem a work of 5 to 10 minutes. But trust me, those 5 to 10 minutes come with a lot of skill, comes with a lot of finesse, comes with a lot of
Experiences.
knowledge behind it. Absolutely correct. Thank you, Madhumita, for joining in. Uh,
Thank
it's
you.
it's been an absolute pleasure for like having you. I'd be wanting to interact with a few other people on this platform as well. But you've been my first guest for the evening. Thank you so
Thank
much,
you, sir. Thank you
and
so much
I
for the
hope you do
opportunity.
well and happy. Thank you so much. Yeah.
Thank you.
So coming back. So now Madhumita seems to be a pro at her work, and what else can we do for Madhumita now as a doctor, or let's say as someone who has been seeing her for quite a while now? For example, suppose she's working in my hospital. What else can we do? What else can we do where we are getting a better version of Madhumita? This is one time when we start working on Madhumita's existing skills, her existing skills of a sonologist, where she's able to, uh, work with the ultrasounds, work with the other radio diagnostic techniques. Gradually, we start talking to her about the pathology of each disease. Gradually, we start, for example, in this case, she was talking about intrapartum surveillance. Gradually, we start talking to her about what are the early markers of Down syndrome. For example, something like a nuchal translucency, or maybe a short femur, or maybe a short nasal bone. Any of these findings, maybe something like a posterior urethral valve. All of these, which are typical anomalies, which are typical genetic anomalies that we will be getting in cases of a Down syndrome or maybe any other chromosomal anomaly. This is the time this is the time when we start putting the practical knowledge of Madhumati aside, because we know she's really good at it, and we start supplementing her with the information, so that now she knows what to see and she knows why she's seeing it. So she already knows what to see. We can try making her better by trying to help her know why she's seeing it, so that the next time there is any pregnant female who's coming to her, and maybe the ward is really busy that time, there's a lot of rush going on, she does not every time have to keep asking the consultant radiologist, because she knows in her head that, okay, these are the things that I look for, these are the reports that I look for, and I'll correlate these reports, the lab reports, with the ultrasound findings. For example, she was talking about seeing a renal calculi. We ask her to do a USG. Suppose we do not find it on the USG, she is good enough to now know that if a calculi is not visible on a USG, we can go for an NCCT. That's a non-contrast CT scan. So it is now making her a lot more strengthened, a lot more skilled in trying to understand that she's already good with the existing amount of work that she knows. We are trying to add a finer layer to it. We are trying to upskill her to know what she's looking at, to know what are the other possibilities of that particular pathological finding, and to add a bit more of knowledge to her, so that now when she sees a patient, she can quickly screen for the kidneys in a case of suspected renal colic, see that there is no stone on the USG, and she can concomitantly tell to the patient right away that, okay, we need to go for an NCCT. Giving her this confidence would not just help her. Many people might think, why to bombard Madhumati with so much of information when it's not even required. There are doctors for that. But are we aware that in our country we are not having a very ideal doctor-patient ratio? We are really not having a good doctor-patient ratio. There are so many times that we are overburdened, we are overrun. The number of patients to the doctors is alarmingly high, and the entire burden being on one person probably does not make the healthcare as effective as it should be. So this is the time when we are trying to upskill everyone else who's working with us. We are all growing together. And what we are trying to do is we are trying to create an environment where they are as confident as us, and the interactions between us, on times when there's an emergency, on times when there's a crisis, they can take over. They can take over in deciding and saying that, okay, I think we need to go for an NCCT. Okay, I think I'm finding a nuchal translucency. Can we please do a karyotyping? It's trying to make them this enable that they are confident about what they are doing, because it has been long that these people have been seen as a mere technician. And I'm so against this view where people do not treat them with the amount of respect that they deserve, because it is these it is these people like Madhumati and all of you, the other ones who are working as lab technicians, as pathologists. It is these people who are one of the major workforces behind what we are doing. I cannot imagine a radio diagnostic consultant without a sonologist. I cannot imagine that. So it is time that we make them earn that place and the respect that they truly deserve. At the same point of time, we are enhancing the the quality of healthcare. We are making each of our workers and our co-workers and colleagues equally adept in trying to understand as to what is going on in a patient. I would want to have a talk with someone who has completed their MBBS. Is there anyone who's wanting to volunteer on being on the camera, on the microphone? Anyone who's completed your MBBS wanting to volunteer? I would love to have a talk with you. Anyone who's wishing to, even if it's not on camera, I'll be glad if I can just have you on the microphone. Anybody? There's nothing to be shy. I'll be really, really glad. Okay, there is someone, Dr. Apeksha. Okay, Dr. Apeksha, are you comfortable with being on the camera? Are you comfortable with being on the microphone? Can we have you? Can we have a talk with you, Dr. Apeksha? Yes, yes. On microphone. Okay. Vijay sir, can we unmute Dr. Apeksha Sharma?
They can unmute themselves. They can unmute
Okay.
themselves. Yeah. Even camera and the mic.
Okay, Apeksha, as you said, you are comfortable on the microphone. Perfectly okay. Hi, Dr. Apeksha. This is Dr. Navonil. How are you doing? Good evening.
Hi, good evening, sir.
Good
I'm
evening.
good. How are you?
I'm doing good, Apeksha. It's a
Yeah,
pleasure to talk to you. And
same here.
just a while back, as you found, I was having a talk with Madhumati, who happens to be a sonologist. I would want
Yes.
you to talk a bit about yourself, about how skin aesthetics is something that you loved joining in. Is it really a branch that you always wanted to join? Or once you joined, what are the things that you have newly learned in skin aesthetics? If you could just give our audience a brief idea about it. So
Yeah,
you
so
have completed your MD in dermatology and then you're doing in skin aesthetics,
no,
or
I've not
okay,
done MD in dermatology. I'm
okay,
currently pursuing this diploma course from Mediversal University in dermatology.
fantastic, fantastic,
And 2 years
fantastic.
back, I completed my master's in skin aesthetics. After completing
Okay.
my MBBS, actually, I was so eager to get into MD branch, but
Hmm.
unfortunately, I wasn't able to get into that. So I
Okay.
pursued this line, which is master's in skin aesthetics, which include everything like cosmetology. And if you want a non-emergency branch, then you should definitely opt for this one.
Okay, so please, Dr.
Yeah.
Apeksha, it's all your platform. Can you please talk about your experiences? Can you please talk about about how someone, and I mean, you are an ideal person, I think, to talk to. So for the ones who are feeling lost after their NEET PG examinations and are feeling that okay, we are not good enough, uh, like I also hear Dr. Vishal Kumar is saying that's the same condition with me, and I think you speaking out to them would mean a lot if you can tell them that it's not the end of the world if you are not able to get through the rat race, or you can take up something, you can learn, you can upskill yourself so that emotionally as well as professionally you feel much better, you feel more boosted, and at some point of time again you can reappear for the net, I mean, for the PG entrance. There's no, absolutely no harm in it. So Apeksha, it's all over to you. I would love
Yes,
you
I
to address the
absolutely
audience.
agree with each and everything that you said, doctor. Even I was very sad because of not getting into my, dream branch. But the second option that I always had in my mind was MD dermatology. And now
Okay.
I knew that I wasn't be able to pay this much amount, like more than 1 crore. So I decided to go for aesthetic medicine. And since I have taken this branch, also when I completed this branch, after that, I am very happy. Personally, I'm very happy because I don't have to attend any emergencies, first of all. And yeah, so it's a good thing. Like, you just don't have to, uh, how can I tell you? Like, it's not very important to, um,
You're probably wanting to say that NEET
yeah,
PG or entrances is
yeah,
not the end of the
yeah.
world. I mean,
Not the end
there's a,
of the world. Yes,
correct.
correct.
So what is something new that you learned in aesthetic medicine, something that is beyond your MBBS knowledge?
Um, Other than dermat patients, like you can help people attend, you know, help people to achieve confidence in their own skin. And
Perfect.
it includes everything like cosmetology, trichology, laser, even assistant hair transplant course was also there in this degree. So yeah,
Fantastic.
it will help. You can definitely help people, and yeah, you can have a bright future in this
Perfect. So are you
field.
are you
Yeah.
attached? Are you attached to any personal clinic or any hospital?
Yes, I am. Yeah, I currently have my own clinic. So I'm
Fantastic.
practicing in my own clinic only from last 2 years. Also, I
Okay.
have a video on YouTube. Like
Fantastic.
I've
And
explained a lot about this thing, and you can
perfect.
find it. I don't remember. It was a
Perfect.
collaboration video with someone else,
I
but
would
yeah,
I would love
I've
to I
explained.
would love to get the link in the chat group. I think every
Yes,
one of us would
definitely.
would love to see at some point
Yes,
of time.
anyone can watch that. I've explained each and everything in detail, and yeah, so it's like
Okay.
that.
Okay, that's lovely. So and where did you complete your MBBS from, if I might
From
ask?
IICTN.
IFCTN. Okay.
Mumbai.
Mumbai.
Yeah.
Mumbai. Okay. Okay. Okay.
Singhania University. And
Okay. Okay.
institute is IICTM.
IRCTM. Okay, okay. So,
Yes.
so, so at some point of time, do you think, I mean, if ever you want to restart your thinking and maybe start an MD dermatology, do you think that whatever courses you have learned, whatever skills you have learned, don't you think it is going to additionally help you in your residency days as well? And it will also help you become a better dermatologist because you already have a baseline knowledge about the other
Yes,
things which are there in
absolutely.
dermatology. Exactly.
Yes, absolutely. It is going to help me. And even today, I'm still preparing for NEET PG because
Fantastic.
yeah, we can appear in exam as many times as we can,
Correct.
and
Correct.
we shall always keep trying only. So
So,
yeah.
so do you think that you learning the courses that you have pursued and you becoming you having from I mean I can imagine setting up your own clinic. It's a very very good thing, and in a field which is very less talked about. I mean, even till 10 years back, I think derma was all about acne and skin tone
Yeah,
and everything. But there's a lot more to dermatology than just skin tone and
so
acne.
much more.
Yeah, there's so
Yeah,
much more. Perfectly. There's
so
there's
much
so
more.
many number of conditions also which we deal with in medicine. For example, things like
Yeah,
psoriasis, things
yes.
like psoriasis is an entirely dermatological and medical. It's a medicine dermat co-integration. So that is
Yeah,
something. There's so many cases that we find where even things like tuberculosis, things like sexually transmitted diseases, all of them come under dermatology. I think you would definitely agree to this, that you having been able to set up your own clinic, seeing your patients, serving your patients in the best way possible, it also gives you a different sense of mental satisfaction. So that when you come back to study at the end of the day for your entrances, you don't feel like you are lost anywhere. You're going to definitely try your best, and I'm wishing you all the very best for your entrance examinations ahead. So I'm very sure that this has helped you even emotionally and psychologically to be a better person. If I'm not wrong.
yes.
Thank you. Thank you. Thank you. Thank you, Dr. Apeksha. It was lovely talking to you. And I wish
Same
you
here. Thank
wish
you.
you wish you a lot of love, wish you a lot of good wishes. And I hope the new year turns out to be really, really well for you.
Yeah,
Thank you.
and
Thank you so
only I
much.
have one thing to tell each and everyone
Yeah.
that after completing MBBS, to my fellow MBBS partners or other BHMS, BUMS doctors as well, not getting into MD is not the end of the world.
Correct.
You should always have another option ready for you. Option B should always be there in your list. And once you get in that branch also, eventually you are going to develop interest in that field as well. So
Correct.
kindly take any field that you get after completing your MBBS, BHMS, BUMS, or anything. Or you work as a GP, then also you have a very bright future. Trust me, there will be no GPs um, in the coming years, like whatever the situation going on
Correct. Correct.
currently. Look
Absolutely.
into that
Absolutely.
situation. Yeah.
Absolutely. Thank you. Thank you, Dr. Apeksha. You speak really well. And I would not be
Thank
surprised
you.
if we have you on one of our webinars trying to, teach important topics or share important updates with us regarding your field. And it would be absolutely lovely to have you on board. So thank you. Thank you, Dr.
Thank
Apeksha. It's
you.
nice,
Thank you.
lovely talking to you.
Thank you,
Thank you. Thank you
doctor.
so much. Yeah.
Thank
Thank you. Dr. Vishal Kumar, he says he wants to have a talk. Vishal, can you try unmuting yourself? Yes. Vijay, can we allow Vishal to unmute himself? Vishal, am I audible?
Doctor, you are loud and clear.
Yeah. Vishal, if you're there, you wanted to have a talk with us. You had written in the chat that you would want to connect. Vishal, if you're available, you can try unmuting yourself or try coming on the camera as well.
Dr. Vishal, can you please unmute yourself and you can talk, or else, yes, you can talk to us. Here is the same condition with me. Can you talk with you? Can we talk with you?
Yes, Dr. Vishal, I would love to have a talk with you, and then I would gradually switch to the other segment of my talk today. Vishal, are you there, Dr. Vishal?
Oh, 1 second.
Are we able to unmute? Are we able to unmute Dr. Vishal? Dr.
Okay.
Vijay? Yeah.
Okay. Okay. Can I audible?
Yes, yes, doctor, you are loud and clear. Yes, you are
Yeah,
audible. You can talk
Vishal,
to
you're
Dr.
audible.
Navonil.
You can come on the camera as well if you're comfortable, and we would love to have a chat with you.
Actually, first of all, I introduce myself.
Absolutely.
Myself, Dr. Vishal. I am completed my MBBS from KGMC Lucknow and
Okay.
MD. The and in MD Physiology, recently we attend the conference in Nimhans, Bangalore. When I in previous year when I completed my MD.
Yeah.
There someone say here is no non-clinical branch and
Correct.
so many that's talking about the non-clinical branch. When we go to Nimhans, Bangalore, the conference will attended and there is no boundaries between the non-clinical branch and today's clinical branch.
Absolutely. Absolutely.
Because all branches are connected with each other, even biochemistry, either anatomy, either physiology, either microbiology, all subjects are connected with the whole thing is it is not that key single subject is non-clinical branches.
Absolutely. Absolutely. Absolutely.
Today, when we go to Nimhans, there is so many research works on every parts and so many updates are available and symposiums we attended and
Hmm.
elevates our knowledge. The Dr. D.K. Pal, who's the director of the AIMS, which organized this beautiful conference. And we also just like ma'am says ki when we doing MD MBBS there is the no limitation of the career is blocked.
Absolutely.
Everything is the knowledge.
Absolutely. Absolutely, sir. So if I might just add to what Dr. Vishal sir says, Dr. Vishal sir says that uh, you know it is already, I mean, it's been long that we have tried to discriminate branches as clinical branches and non-clinical branches. We have always tried saying that the clinical branches are superior, but
Yes,
technically there is nothing superior, nothing inferior. We are all
yes,
interconnected. Everything
yeah,
is interconnected. Even in our MBBS days, I cannot understand a word of medicine if I do not know what physiology is. I cannot
yeah,
understand a word of pathology if I do not know how the normal systems work.
yeah,
And
yeah,
sir rightly talked about NIMHANS. I have been to NIMHANS before as well, multiple number of times. And
yeah,
indeed, not just with clinical and non-clinical branches, they are also associated with with non-MBBS branches, like say psychology,
Yeah,
where
yeah,
masters in psychology,
yeah,
even they are
yeah,
intertwined with each other,
yeah,
and in each of their research works, in each
yeah,
of the patients that they see, for example, a patient of stroke may be
yeah,
evaluated not just by a neurologist, but also by an anatomist, also evaluated by a person of physiology, also
yeah,
evaluated by someone who is pursuing psychology. I mean, Dr. Vishal, you've been there personally, you would agree to it that all of their research works is like an interdisciplinary team. It's a
yeah,
team of many members.
yeah.
Absolutely,
Absolutely right. Absolutely right. Uh,
absolutely.
when we attend a workshop for sleep, the
Yeah,
when we attending the sleep work, the team will included so many PhD students, BTech students,
correct.
all students are involved and doing very well. Where this knowledge will very high because even we don't know. Even I completed MBBS, MD. I don't know anything. That's the truth.
Absolutely. Absolutely. And then that is from where you start knowing a few newer things, and even they start knowing a few newer things. And it's a combination of this knowledge, I think, which
Yeah,
which brings us up. 10 years,
yeah,
12 years back, the usual I mean the usual norm that someone who's pursuing a physiology or an anatomy is probably not a doctor. I mean, that is
yeah,
exactly how the society
yeah,
would think. But
yeah.
even today, I'm very sorry that most people think of it that way, unless they really get into seeing what kind of work is happening, the research works that are happening. I can even say for a field like psychiatry, there is so
Yeah,
much of help from a physiologist that we need in a psychiatry. There's so
yeah,
much of, as sir was talking about sleep disorders, we can
yeah,
talk of the neurotransmitters that are being released from the brain. Physiology plays such an important role in even a disease like psychiatry. I'm talking of psychiatry because NIMHANS is not just neurology; it also has a separate wing for mental health disorders.
yeah, yeah,
So, I mean, that is truly amazing. So
yeah,
do you think today, like, if I just might ask you, do you think that if a course comes up where you are also being taught the nitty-gritties of medicine along with your existing physiology knowledge, if you
yeah,
think that once we start upskilling ourselves with medicine, I'm very sure you are still into reading Harrison's textbooks. You, even
yeah,
as a physiologist, you are reading medicine textbooks, because at
yeah,
the end of the day we are a doctor and we have to understand the disease pathologies associated with the normal abnormal response to the normal physiological system. So don't you think that today, if for example, if renal physiology is your topic of interest, or let's say neurophysiology is your topic of interest, don't you
yeah,
think that uh, giving you an extra filter of knowing the nitty-gritties of neurology, of knowing how to manage a stroke, how what are the things that we would see, would also help you as a doctor of physiology to integrate that better, and you would also be able to present these cases, or present your papers or whatever you are wishing to present as
yeah,
case reports ahead. Don't you think it will be better if we help, if we are trying to upskill ourselves also with the knowledge of medicine, adding it to physiology?
yeah, yeah, yeah. Actually, they are in NIMHANS.
Yeah,
Even medicine, we only talk about only medicine knows how to the makes the cause the disease and pathology and the core root. The disease of core root is not known. The medicine MD medicine people.
people,
The
yes.
the core, the basic principle is not known. We only as prescribe the medicine. The,
Correct, correct. Absolutely, absolutely. So
yeah,
that is exactly where, and let's not forget, this time the Nobel Prize was awarded for
yeah,
physiology.
yeah, yeah,
And it was awarded to the three doctor cum scientists for immune tolerance, for peripheral tolerance, and that
yeah,
again comes from the Department of Physiology. So
yeah, yeah,
I think we should be I think that should be an example for us to look forward to, and realize that there is absolutely no difference in between a clinical and a non-clinical branch. If a non-clinical branch can get a Nobel Prize, I think we are too stupid enough to not consider them important. That's what I believe. So I think it's always an integrated approach, and uh, the more integrated we stay, the more closer we stay to each other instead of creating divide. I think the better for us and the better for the profession. If that is what you might say, Dr. Vishal.
yeah, some updated the previous year's DM course started in the Patna AIMS. Dr. GK Pal will started DM integrated physiologies in the first
Fantastic,
semester today.
fantastic. Fantastic, fantastic. Thank you, Dr. Vishal. It was pleasure having you. Thank you so much.
Thank you so much.
Thank you. And my last interaction for the day will be with someone who has completed his or her BAMS, BAMS. Can I have someone on board? Can I please have someone from BAMS to talk about? I've tried talking to, as you might see, I've tried talking to an MBBS graduate. I've tried talking to an MBBS and an MD graduate. I've tried talking to a sonologist, and I'll also try talking to a BAMS. So these are the. I'll try talking to one member out of these 4 niches, so that I can give a better idea. Anyone from BAMS? Dr. Vishal sir, if you could please unmute yourself. I mean, if you could please mute yourself. Sorry. Yeah. Anyone from the BAMS field? Anyone wanting to chip in, wanting to have a talk? Anybody? Anybody who's completed your BAMS? Yes, I think there's someone. Yes, BHMS. Okay, BHMS. Dr. Pratibha Shukla. Yes. Are you good enough? Are you comfortable enough, Dr. Pratibha, to come on the camera and the microphone, or would you just want to be on the microphone? Anything is good enough with me. Dr. Pratibha, are you there with us?
Dr. Pratibha, you can try to, Dr. Pratibha is on the call. You can unmute yourself and you can talk, Dr. Pratibha.
Good evening, sir.
Hi. Good evening. Good evening, Dr. Pratibha. It's a pleasure meeting you. How are you doing?
I'm fine. Thank you.
Thank you. Would you be comfortable enough to talk to you about your journey of a BHMS, and where are you currently working in, or like whatever you would want to share?
Sir, could you speak in Hindi?
या क्या आप हमें बता सकते हैं, अपनी जर्नी के बारे में बता सकते हैं? क्या आप हमें ये बोल सकते हैं कि फिलहाल आप किस ऑर्गेनाइजेशन के साथ जुड़ी हुई है, या फिर किस हॉस्पिटल के साथ जुड़ी हुई है, या फिर आप अपनी अनुभव हमसे व्यक्त कर सकते हैं?
मेरे हॉस्पिटल का नाम है प्रभावती हॉस्पिटल, और
ओके,
बदलापुर में सिचुएटेड है, डिस्ट्रिक्ट जौनपुर है, और यहाँ मैं एज ए गायनेकोलॉजिस्ट प्रैक्टिस करती हूँ।
बहुत बढ़िया।
हाँ, BHMS तो है ही मेरा, और PGDGO की भी डिग्री है।
ओके,
मेडिवर्सल यूनिवर्सिटी से है, मेडिवर्सल से। और यहाँ पे जनरल OPD वगैरह हो गया, या डिलीवरी DNC, ये सब मैं खुद कराती हूँ। और सीजर
अच्छी बात
वगैरह
है।
का केस वो आते हैं, डॉक्टर अपनी टीम के साथ आते हैं, एनेस्थेटिक आते हैं, सर्जन आते हैं, वो करते हैं। इसी तरीके से है सर। इनफर्टिलिटी का हमारे यहाँ ज्यादा वो है,
बहुत अच्छी
इनफर्टिलिटी
बात
के
है।
ऐसे भी केसेस होते हैं हमारे यहाँ।
हम्म,
मतलब मैंने जो दिया है ट्रीटमेंट, उस बेसिस पे कई लोगों का सक्सेस हुआ है। इवन स्पर्म काउंट अगर नील है तो भी हमारे यहाँ जो ट्रीटमेंट दे रहे हैं, तो वो भी कपल जो है इस चीज का उन्होंने वो सुख पाया है कि बच्चा हो गया, पेशेंट कंसीव की है 3 to
बहुत
6
बढ़िया,
मंथ का।
बहुत बढ़िया, बहुत बढ़िया। आप यूजुअली
जी सर।
इनफर्टिलिटी केसेस को किस तरीके से ट्रीट करते हैं? आप क्या देते हो
पहले तो
उनमें?
उनका चेकअप कराते हैं, बोथ पार्टनर का, मेल फीमेल में क्या है,
बिल्कुल।
डायग्नोसिस क्लियर हो जाती है। देन
हाँ,
जो है मैं ट्रीटमेंट करती हूँ, किसका दवा कितने दिन चलना है। अगर मेल पार्टनर का नील आ रहा है काउंट, तो 6 मंथ तक तो हमको बताते हैं, क्योंकि सर बदलापुर में बहुत लंबा ड्यूरेशन बता देंगे तो पेशेंट पहले ही भड़क जाएगा कि अरे इतने दिन तक मैम ट्रीटमेंट करेंगे। तो
बिल्कुल
3 to
बिल्कुल
6 मंथ बताते हैं। उनको प्रिकॉशन बताते हैं कि आप कोई ऐसी चीजें मत लीजिए, जैसे एल्कोहल वगैरह हो गया, कोई भी
अल्कोहल।
नशे पत्ते वाली
हाँ,
चीजें, तो इससे मेडिसिन का इफेक्ट कम हो जाता है।
बिल्कुल।
और योग प्राणायाम भी बता देते हैं कि आपका डाइट प्रॉपर होना चाहिए, और आप जो है आपका रूटीन बढ़िया हो, आप थोड़ा सा योग प्राणायाम करिए, बाकी मेरी मेडिसिन लेते रहिए, सारी चीजें समझा के। और साथ ही साथ अगर पेशेंट फीमेल में कोई दिक्कत नहीं है, उसका पीरियड सही है, सारी चीजें ठीक है, ओव्यूलेशन प्रॉपर है, तो भी उसको मैं कुछ मेडिसिन ऐड कर देती हूँ, जैसे ओवा ब्लेस हो गया हमारा, ओवा केम हो गया, ये सब 2-3 MR आते हैं, उनकी दवा मैंने रखी है। ओवा ब्लेस का
बहुत
रिस्पॉन्स अच्छा है।
हम्म,
और मेल पार्टनर को मैं कैप्सूल लेडीजुआ देती हूँ,
अच्छा
स्पर्मोन कैप्सूल देती हूँ, एक सेट
अच्छा,
सीसी कैप्सूल आता है, वो भी मैं
बहुत
ऐड कर
बढ़िया,
देती हूँ।
बहुत बढ़िया।
और एक एफर्ट एम करके मल्टीविटामिन है, वो भी मैं देती हूँ।
मल्टीविटामिन, हाँ, बहुत
जी
बढ़िया। और आप महिलाओं में शादीशुदा महिलाएं नहीं, जो कि कुंवारी लड़की है, उनमें आप किस
जी
तरह की बीमारी ज्यादा देखते हो? क्योंकि आप गायनेकोलॉजिस्ट हो, मैं इसलिए आपसे पूछ रहा
पीसीओडी
हूँ।
वगैरह हो गया, प्रोलॉन्ग साइकिल हो गया, शॉर्ट साइकिल हो गया, मिनोरेसिया, डिसमिनोरिया, ये सब चीजें ज्यादा देखने को मिलती हैं। और सबसे ज्यादा सर आजकल ये देखने को मिल रहा है, कम एज में बच्चियों को मतलब पीरियड आ जा रहा है, जो मिनार्की है वो कम ही एज में हो जा रहा
बहुत
है,
बहुत
10 साल में,
बहुत बड़ी
11
बात
साल
बोली
में।
आपने।
हाँ
बिल्कुल
तो
सही, बिल्कुल सही।
हाँ, मतलब ओव्यूलेशन प्रॉपर हो नहीं रहा है, बॉडी उस चीज के लिए एक्सेप्ट नहीं कर पा रही है कि किस तरीके से कम एज में पीरियड आ जा रहा है, कभी एक्सेसिव फ्लो हो रहा है, तो उससे घर के जो पेरेंट्स होते हैं, उनके माता पिता, वो बहुत ज्यादा परेशान हो जाते हैं।
परेशान हो जाते हैं, बिल्कुल।
अक्सर ये केसेस मैंने देखा है, अनमैरिड लड़कियों जो कम एज की बच्चियां हैं, 10 साल, 11 साल, 12 साल, या फिर पीसीओडी से लोग ज्यादा परेशान हैं।
करेक्ट करेक्ट।
अच्छा, दूसरी चीज सर मैंने ये देखा है कि मेरे ओपीडी में जो ये क्या बोलते हैं, प्रोलैक्टिन हार्मोन,
प्रोलैक्टिन
ये
हार्मोन,
बढ़
हाँ।
जा जी, ये इंक्रीज हो रहा है, जिसकी वजह से मिल्क सिक्रीट कर रहा है, तो उसमें कैबागोलिन दे के उस चीज
कैबोकोलिन
को
दे,
जो है जी
बहुत बढ़िया, बहुत बढ़िया। अच्छा, आप बदलापुर में काम करती है, राइट? जैसे आपने अभी कहा।
जी सर, जी
हाँ,
सर।
तो ये जहाँ पे आप है, वहाँ पे मतलब क्या वो शहर से बहुत दूर है या मेन सिटी के अंदर ही है?
मेरा बदलापुर जो है बहुत दूर नहीं है, जौनपुर से 30 किलोमीटर के डिस्टेंस पे है, जो जौनपुर जिला है,
हाँ
डिस्ट्रिक्ट
हाँ,
है
जौनपुर
हमारा।
जिला है, हाँ हाँ।
हाँ, उससे 30 किलोमीटर दूरी पे है।
बढ़िया। तो वहां पे हम जिस तरीके की पेशेंट्स को देखते हैं, आपको कभी लगा है कि खाने पीने की जो उनकी जो हैबिट्स है, बचपन से जो खाने पीने की हैबिट्स, आजकल थोड़ा फास्ट फूड जंक फूड का थोड़ा प्रभाव बढ़
हाँ,
चुका है,
यूजुअली
क्या
लोग, हाँ
उनसे कभी आपको लगा है कि इस पीढ़ी के जो जो खाने पीने की जो जो धारण है, जो जो मेथड है, उससे उससे भी कुछ गायनेकोलॉजिकल चीजें ज्यादा प्रभावित करती है, मतलब खाने खाने
हाँ,
से ज्यादा प्रभावित होता है? क्या आपको कभी
यस
ये
सर,
महसूस हुआ है?
होता है सर, बहुत इफेक्ट पड़ता है। अगर डाइट हेल्थी नहीं है, अगर उनका जो है
बिल्कुल।
खान पान सही नहीं है, जंक फूड ज्यादा
हम्म
ले रहे, और
हम्म
अक्सर जो है जो बच्चे आते हैं अपने मम्मी के साथ, तो उनके पेरेंट्स यही कंप्लेन करते हैं कि ये खाती
हम्म,
नहीं है, खाती भी है तो
बिल्कुल।
ऐसी ऐसी चीजें खाती हैं, दूध नहीं लेंगी,
हम्म,
दाल नहीं लेंगी, हरी
हम्म,
सब्जियां नहीं लेंगी, तो ये
हम्म,
कंप्लेन आती है। तो फिर उनको समझाया जाता है कि बेटा अपना डाइट प्रॉपर रखो, हेल्थी फूड खाओ, ताकि ये सब दिक्कत ना हो, नहीं तो आप डिस्चार्ज की प्रॉब्लम, डिस्चार्ज फ्री भी देखने को मिलता है,
हाँ,
वीकनेस की वजह से, वाइट डिस्चार्ज, ल्यूकोरिया की प्रॉब्लम रहती है,
करेक्ट
बैकेट रहता
करेक्ट।
है।
हम्म,
हम्म हम्म।
ओके
और सर मेरा
ओके।
यहाँ पे तो 16-17 साल तो हो ही गया प्रैक्टिस करते हुए।
थैंक यू थैंक यू थैंक यू थैंक यू प्रतिभा जी, थैंक यू, बहुत बहुत खुशी हुई आपसे बात करके।
थैंक
थैंक
यू
यू सो
सर,
मच।
थैंक यू।
ओके ओके। Can we have someone who is not from an MBBS field? Because we have already been talking only to doctors. Can we have someone maybe from other health allied aspects? I think Samprikta was there. I think Samprikta was there. Is Samprikta? Are you there? Are you there on the? Are you there for a quick chat with us? Can we have you, Samprikta? Can you be please available on the mic and the camera? I I think Samrita is not there. Otherwise, I would have brought in for a nutrition related insights. But yeah, okay. So first of all, I think this is the first time on webinar. I think Srinivas sir, Vijay sir, if you are able to listen to me, I think this is the first time that we are having such a wide range of interaction. I mean, I was so touched while talking to Dr. Pratibha. She happens to be a BHMS graduate, and she's been working as a gynecologist, and
True.
she has taken her her PGDGO from Mediversal. See, the platform is not important. Again, I mean, I think that is something which I want to unanimously say. If you see today, I've not sat with trying to promote something. I've
Yes.
just tried to make us come together, because this is the end of the year. Probably, maybe we'll have a few more webinars to sign off this year with, and we'll start on from the next year with a new source of vigor and energy. But I was so touched when I heard Pratibha ji. I'm calling her Ji because she happens to be really senior to me, and Pratibha ji gave such a wonderful insight about what is to be done, what are the things she faces, what are the challenges that she encounters. And you
Yes.
can see how coming from a background of BHMS, she's done her PGDGO, she's upskilled herself to a level now where she's she's at par with the surgeon, with the anesthetist, with the gynecologist, other gynecologists who are there. So I
Very,
think
very
this is for the first
inspiring.
time. Yeah, and Srinivas, I think this is for the first time that we have had such a multi-dimensional conversation with all the with at least one or two members from different fraternities. And I think it's one of the best things that can happen on any platform. Again, I'm not trying to promote anything, but I think this is the need of the hour, that in a webinar where one person is speaking, we can gradually start bringing in different people, try to hear their experiences. Because as someone rightly says, we can become wiser by hearing someone's wisdom. We can get wiser by hearing someone's experience. And like people like Madhumati, people like Pratibhaji, Apeksha, Dr. Vishal sir, each one of us, I mean, they have had an impact on me. And it also summarizes the fact that I wanted to talk of in the very beginning today, that just see that unlike the trend that we know, that you complete your graduation, you complete your MBBS, and then it's only need PG. There's only one way that you can go through. There's no other way that you can go through. It's a wrong belief. It's a wrong belief. And there is so much to explore. Uh, how many of you are into reading books? I'm not really sure, but there happens to be a poem by Mr. Robert Frost, and the name of the poem is Two Roads. And I would just quote a few lines from that poem. My father happened to be an English teacher. I lost my father a few days back, so my father happened to be an English teacher. And he has been someone who has had a profound inspiration on me, a profound effect on me in trying to integrate life with literature. So in his honor, I would just try saying a few lines which he always used to say, that uh, two roads diverged in a yellow wood, and I took the one less traveled by, and that has made all the difference. So what I mean to say is, there are always two roads, or let's say multiple roads to a certain destination. Yes, we always want to take the road that is the most traveled by. That's because we are insecure, and that's completely understandable. But trust me, there are very few brave people who would want to take a road that is less traveled by. And the ones who do it are also the ones who make a difference. They're the ones who learn. Maybe they commit more mistakes, but they learn through those mistakes. And when we learn through our mistakes, we just get better. And I think Mediversal in itself is another example of this. And again, I'm saying, not saying this from the promotional point of view or something, not because I've been associated with Mediversal. For people who do not know, I have not been someone whom Mediversal has hired right from day one. I mean, I have been a student of Mediversal courses, and I have been an individual practitioner. And it's just that we have collaborated because our beliefs regarding the medical education system happens to be the same. I mean, that is one way where I think we have collaborated. And I'm not talking to you all from being an academic committee member of Mediversal, but I'm trying to talk to you that whichever place you belong to, whichever platform you belong to, trust me, it's not about Mediversal. Whichever course you take up, it is just to tell you that NEET PG, या फिर one entrance examination, the results of an entrance examination is not the only thing that you need to go after. There are so many other ways. At the end of the day, something which I've always believed, when we were in class 6, 7, 8, या फिर 10, 11, 12, when we were starting to weave the dream of becoming a doctor, did we really know how many entrances to clear? Did we really know what rank we have to get one particular seat? No, right? We were all focused on becoming good doctors. We were focused on providing the elite healthcare to people. So that is exactly what has brought all of us here today. All the participants are here today because we all are in sync with this fact that we are going to be good doctors, I believe. So that is something which I have always believed is something to look out for. And I'd be sharing my screen. I'd be just taking you through a few slides. Just a moment.
Doctor, we have one question. Dr. Chand is asking, how will this help? And we
Yeah,
have also, yeah, and
perfect.
we have,
I'm going to there. I'm
yeah,
going there, Dr. Chand. Yeah.
and
So I'll be
Elizabeth,
sharing.
yeah, and Elizabeth is asking, very few agree that integrated approach is the need of the hour.
But again, I admit that very few agree to this, but a few people agreeing to this probably won't shy away from the truth that integrated approach is the need of the hour. And let me tell you, even for entrance examinations, all the questions that are being set today in the entrance examinations, I've been following the entrance examinations since the last 7-8 years, to be honest. I have myself appeared in the entrance in 2023. So I can tell you that, and I have also appeared in an entrance of AIMS this year. So I can tell you this, that integrated questions are being made. Integrated approach is what is being followed in all the elite institutions of this country, like AIMS, like NIMHANS. Any patient is seen via a multidisciplinary team. It is not one particular team that sees a patient. So I believe that the world will move forward. Not the world, let's say our country. The world has already gotten into believing that integrated way of learning is the need of the hour. You can check out on all medical platforms and all medical examinations that are conducted outside the country. USMLE, PLAB. Each one of these exams will have an integrated way of asking questions, an integrated approach of teaching. So I mean, that's I mean, there's nothing that I can, say more than that. Now I'll be trying to share my screen, and just give me a moment. Yeah. Is my screen visible? Vijay, is my screen visible?
Yes, yes, it is shared. Orientation. Yeah, yeah, yeah.
Yeah, fantastic. So as I said, this is not about promoting something. This is just telling that our organization, Mediversal, is in line with the kind of thoughts that I wanted to say. It's not about saying that what are we doing. No, it's rather telling you that there are multiple opportunities, and not just Mediversal. There are so many other platforms who are trying to upskill you. Just because I happen to be a member of Mediversal, this is why I am trying to talk to you about the ventures that we have launched or we have tried launching. So before I go to the testimonials, I would first show you a few written testimonials. So Dr. Namrata, and then we have Dr. Mahesh. We are having Dr. Somijit Chatterjee. So you can see people from different niches, family medicine, from orthopedics, everyone. So Dr. Veeray, Arif Gulzar, Dr. Mahesh, infectious diseases, diabetology. We're having multiple testimonials. I won't waste your time by taking you through each of the Instagram shots, or as I said, this is not at all a promotional webinar that we are having. What I wanted, and that's the kind of discussion that Srinivas sir also had with me, is let us not try promoting our organization. Let us try dealing with the real problems that need to be solved. And the problems that need to be solved are the ones where people are feeling lost out, they're feeling left out. They're feeling that okay, just because they are a BAMS or a BHMS graduate, they cannot participate with a consultant of medicine. It is about breaking the barriers. It is about breaking this discrimination. It's about breaking a barrier where a sonologist feels comfortable enough to share her opinion with the radio diagnostic consultant, so that she can take a better part in healthcare system, trying to make healthcare better. That is exactly what we are trying to do. We have been here in the business for the last four plus years. There's around 1000 plus hours of content, almost 7.5K certified doctors and trained medical professionals. Um, Above everything, there are not just cases, there are not just courses, there are not just webinars, but also case studies that are being published. I am a curator of one of these case study platforms where we are trying to bring in real life case scenarios. We are trying to build in real life cases that come to the hospital. Most of these cases are curated by me. The cases which usually come to my hospital, I try to, remove the ethical issues and like not disclosing the name and everything. But then we try to create as simulatory a real life case as we can. And we try to present it to the audience so that anyone who's sitting in any part of this country, anyone. So, for example, if I am working in Kolkata or say Hyderabad or Chennai, someone sitting in Assam, someone sitting in Kashmir, someone sitting in Himachal, Shimla, Punjab, uh, Madurai, anywhere in this country gets access to the cases that I am encountering. And it's a one-to-one discussion, because after a certain window of a few hours, there's a video which comes up after the case discussion, talking about what we saw in that patient and how we dealt forward with the case. So that is also a case study vignette that we have started in the recent while. Mediversal has its offices not just in this country, but it's also expanding internationally, and that's I believe it is only owing to the belief that we have, to the system that we have. And as Twinkle correctly pointed out, uh, that there are very few platforms right now which are being so open in trying to bring in everyone together in the process of healthcare, and making healthcare and education of healthcare something which is to be looked out for in the upcoming years. So this is Mediversal's Dubai office. We have offices in Gurgaon. We have offices in Bangalore. The addresses are mentioned here, and I'd be so happy if anyone who resides in and around these areas will love to visit the office. You're always welcome. Mediversal's Ahmedabad office. And we have our academic committee, where, of course, we are having Dr. Alan Thomas, who is the academic head, and Dr. Ankush, Dr. Charu, and Dr. Me. So we are all a part of the academic committee. We are trying to create this niche. We are trying to create a curriculum where we can cater to not just building better doctors, but also building more confident doctors. We are trying to upskill yourself. For example, someone who has probably done her master's in sonology, we are trying to offer a diploma or a fellowship, or let's say an advanced certificate level course, where we are trying to teach them the basics of obstetric imaging, trying to teach them the basics of obstetrics and gynecology, so that now someone like Madhumati becomes a pro in not just seeing what she has known to see all these years, but she's also a pro in understanding why she's seeing that, in understanding what else she can think of as a differential diagnosis. I mean, a woman coming to her with short cycles or irregular cycles is not just a PCOD, right? There can be so many other differential diagnoses to it. It's about telling her, it's about training her to know what the other differential diagnoses are, training her to see what else can be seen, and making her a better version of what she is. Someone like a Dr. Vishal sir, making them integrated with neuromedicine, so that once they are of that level where where sir can integrate his physiology knowledge with the existing courses of neurology, neuromedicine, neurophysiology, he becomes an even better person than what he already is. So when he's going to go to places like AIMS, to places like NIMHANS, where integrated neurodevelopment is being studied, his knowledge from there and the existing knowledge that he has combines together to create a difference. And that is exactly what we are trying to do. We are trying to create a world of difference. Just quickly going through the awards and recognitions. So, as I said, there are recorded sessions by not just national experts, there are recorded sessions by international experts as well. There are live webinars, there are doubt clarifications, case series, as I already mentioned. I am taking care of that section. Evidence-based learnings through CCMEs and ACMEs. Clinical attachments at partner hospitals. Okay, so there's someone who asked a while back, how will these courses help? So for someone who has completed your MBBS or BMS or BHMS just in the recent past, and you're still stuck as to how to start on your journey as a professional. Today, if I just take the example of an MBBS, there is probably, if not less, there are probably 700 MBBS graduates that are coming out of a state in one particular academic year. 700 is the least that I'm saying. It's almost 1,000. For a place like West Bengal, it's around 1,500 to 2,000 medical graduates who come out. So after 2024-25 session, There's 2,000 medical graduates that have come out from West Bengal, right? Now, all of you have completed your MBBS. If all of you, your one option is all of you start preparing for your NEET PGs or the postgraduate entrance examinations, and you start preparing, and that's a separate rat race altogether. You give your exams well, God willing, touch wood, you give your exams well, you get a good score, you get your branch of choice. But that is always not going to be so easy, because it's not just a rat race. There's a lot of things with respect to reservations, to seats, to a lot of academic fiascos that keep happening. The counselings keep getting cancelled, Supreme Court cases pending. No one is really sure about when the exam is going to happen. एक डेट निकलता है, फिर उसका पोस्टमार्टमेंट आता है, अगेन अ पोस्टमार्टमेंट हैपेंस, अगेन a preponement happens, and all of these fiascos keep on happening. Enough to, blow your minds off, right, mate? So the other side of the story is, okay, on one hand, you're really preparing for your entrance examinations. That's really cool. On the other hand, amidst sitting at home and preparing for 1 or 2 years, what happens is we start forgetting that we are not robots who are solving an MCQ, because entrance examination is predominantly MCQ based. We start feeling that we have become robots who are just meant to take a right answer, see the explanation, and move on. But that's not really why we have come into this profession. We start forgetting the very basis, the very reason for why we have entered into this profession. And this is exactly where courses like this come up, where platforms like this come up. As I'm saying, it's not just about Mediversal. There's so much happening around, but I'm just talking about Mediversal, because I am an integrated part of this. I've been seeing the growth of this fraternity since the last 4.5 years. And the one thing that we are trying to do is we are trying to upskill you all. So for someone who is tired of this rat race, who has literally given up all hopes and thinks that, no, I'm not good enough, we are trying to put an arm around you and say, hey, mate, come on. Your work is to be a good doctor. Let's start exploring the area of your choice. Maybe that person is interested in nephrology. Maybe he's interested in managing ICU cases, managing in working as a duty medical officer in an RMO, or an RMO in the HDU or the ICU, but is afraid because since the last 2.5 years, he has been just sitting at home and practicing MCQs. He or she is extremely worried, concerned that, am I good enough to still work in the ICU setup? I've completed my internship 2 years back. Am I still having my clinical knowledge intact? Am I still having my clinical skills intact? Am I still able to solve cases? Am I still able to understand what are the differential diagnosis to a case? That is exactly where Mediversal is coming in. Number one, with its webinars, where we are trying to keep you updated about every day-to-day case that we would encounter. Number two, through the case series, where we are trying to portray cases, and that's how the cases are being made. I mean, in a month, maybe I'm posting 12 cases on rheumatology. Then the next month, I'm posting 12 cases on pulmonology. Following month, I'm posting maybe 12 cases on gastroenterology. So that is about keeping you aware of every nitty-gritty of medicine, everything that you might encounter in an ICU, in an OPD. We are also having webinars which are OPD specific, as in for someone who even wants to be a general physician. We are trying to cater to areas where we are trying to say this, that what is the approach that a physician should take in the OP? What is the approach to chest pain in the OP? What is the approach to maybe a headache in the OP? What is the approach to dementia in the OP? We are trying to deal with that as well. At the same point of time, we are also having partnership with certain hospitals. So we are having partnership with hospitals. I'll be taking you through. So these are basically the CME credit points that you would get. Just a demo certificate. We have got our course educators from John Hopkins, Harvard University, the Warren Alpert, and the Yale University, all extremely recognized universities in the West. These are the visionary trainers, Dr. Kunal, Dr. Raina, myself, and this is our esteemed Indian faculty team, along with the foreign medical team that we have. So we have a wide range of courses, as I said, from anatomy to family medicine, to pathology, to nephrology, to sports medicine. I mean, that is something which is very less talked of in India, to things like emergencies and clinical neurology, and even as high yield courses like biogenetics. We are trying to cover it all. And for someone, again, who was saying, what is the use of all of this? So we are having a unified hospital partnerships. You can see these are the hospitals that we are currently associated with. There are a lot of other hospitals which we are, having a talk with, which includes the most renowned hospitals, like maybe we might start featuring with maybe hospitals like Apollo or maybe Fortis in the upcoming future. We are still having talks with them. This is the list of hospitals that we are currently associated with. So what happens now is, once you are a member of Mediversal, once you are pursuing courses from Mediversal and completing the certain duration of that course, you are, which based on whichever location you belong to in this country, you are entitled to reach out to these hospitals if you're wanting to work with these hospitals, in these hospitals, as a duty medical officer, or if you're wanting to work as a clinical observer, or you're wanting to take up some fellowship courses from this hospital. You are entitled to be there, to submit your CV, and you would definitely get an edge over someone who is not who is just probably completed his MBBS and not upskilled themselves more. You will probably get an edge more over that person, because say I complete my MBBS today, and I am a bit tired out of the rat race of NEET PG and AIMS PG entrances, and I decided to take a course on emergency medicine, a fellowship course on emergency medicine, or an advanced certificate level course on emergency medicine. And once I complete it after a duration of say 6 months or 1 year, whatever the course duration is, I am entitled to reach out to my nearest hospitals, one of these hospitals if I'm staying near, or any hospital for that matter, and the person who's hiring me knows that above and over the baseline MBBS knowledge that I have of emergencies, I've also done a separate certificate course which has taught me how to deal with certain emergencies. And of course, I will be getting an edge over someone else who has not upskilled themselves to that level. So that is an advantage that we are surely going to get. And these are the academic international affiliations that we have. I would not take you directly through it because I think the slides will be there for you all to see. This is the course completion certificate. You can clearly see this, that successful completion of PG diploma course in endocrinology. You have PG diploma in neurology, and you have the academic transcript as well, where after the exam you'll be shown what is your performance in that particular exam that you've given, because every course is designed in a way that after you complete the esteemed duration of that course, you will be taken in through an exam, and in that examination, based on your results, you will be given a certificate of completion and a certificate of acknowledgement as well. So these are the advanced certificate courses that we have. And these are the new courses which are being launched. Ultrasound assessment during the second and third trimesters. There are a lot of in-house workshop courses that are also being trying to be coming up in the pipeline in the upcoming few months. There's a brief talk on AI into healthcare that both Srinivas sir and me had a few months back. Even a workshop was there on AI, which was conducted at the Bangalore office, in the newly opened Bangalore center. There are many other offline centers which are going to come up in the upcoming months, and we'll be trying to create as many hands-on courses as well, because in the hospitals, for people working in the emergencies, the hands-on courses is something that will really help you, where we will try to teach you the basics of mechanical ventilation, intubation, ventilator settings, ultrasound guidance. So we'll be trying to bring in expert faculties from each of these branches, and we'll try creating an environment where you are not behind anybody, you are at par, you are at level with the existing amount of demand that is there in the hospitals for work. And if in this while you clear through your NEET PGs, well and good, congratulations. We can always embark on that journey. But trust me, even when you go to your PGs and residencies, you knowing how to do an ultrasound, you knowing how to intubate a patient, how to ventilate a patient, is just going to be an additional cherry on the cake, a feather on your cap. Okay, so where other residents will be taking time to learn that, you already will have learned that skill. So that is something which again creates a world of difference for you and as well for your patients. USG courses, as I said, USG is not something that you can sit at home and study. You need to be doing it. So we are trying to create that environment where we call you into the offline centers, we create workshops, we create symposiums where expert faculties come and do hands-on, I mean hand to hand, one-on-one training with you. So we're coming up with things like cosmetology and aesthetic medicine as well, which is kind of the need of the hour. And these are credit points that you earn. You earn reward points, which you can, share with others, and try getting them. We have a link from YouTube. You can see this. For example, if you are watching this, you complete watching this entire thing. This is on neurocognitive disorders. You can easily, try referring this, try sharing this, and try sharing this with your peers, and try getting a reward point, or a credit point, as it is popularly known as. So, uh, just a minute, let me take you through. We have our academic partners and our clinical partners. As I said, in clinical partnerships, we are associated with the respective list of hospitals that I already shared a while back. And so again, why Mediversal? And again, I would not want to focus much on this slide, because it looks very much as if I'm trying to, boast about this platform, which I'm definitely not. So we have a number of credit OPDRs, which is, Mediversal is giving immense number of OPDRs credit compared to other platforms. Renowned international faculties from John Hopkins, from Harvard. Case-based learning. I think this is something which has been one thing which I can really, boast of as our brainchild, because a few months back, when I had proposed this idea to Srinivas sir, I'm so glad that he had taken this up with a warm embrace, that we can try simulating real life case scenarios that we encounter in hospitals, and try sharing it with doctors throughout the country, so that everyone, a person sitting in Kanyakumari should not feel left out as to what is happening in Delhi, or a person sitting in West Bengal should not feel left out as to what is happening in Gujarat. And that is exactly the idea behind simulating these real life scenarios. There's an AI supported learning. We are also, as I said, we are trying to put AI modules. In the upcoming future, I would try even making flashcards. And even for the ones who are, pursuing NEET PG, there's something that I had a talk with Durgesh sir and Srinivas sir a few months back. We will be definitely trying to launch a few things, maybe some flashcard based learning, maybe some AI based or Anki based learnings, which will, try helping you revise the content in a faster way, in a better way, and try keeping you at pace. So we are trying to cover every end, but predominantly in the bigger setup, we are trying to make sure that everyone knows that PG entrance and its examination and its results are not the only way by which you can move in. So I just keep on saying that take the road that is also less traveled by, because the one that is less traveled by is still unexplored, and exploring that would create a world of difference. Maybe if you take up the first step in exploring that, after a few years, many others would follow, and that would again be one of the norms. So I'm wanting to break a certain cultural or a rigid norm by which everyone feels that entrances are the only way to move forward. So we are having a, like, we usually would offer gifts and special discounts, special coupons. We would usually do it, and anyone who's a part of today's session will be getting a gift voucher. So anyone who would wish to take up a certain course from Mediversal, based on whatever field you would want to explore, is again something that I would love having all of you. And also something for the ones, not just for the MBBS ones, for the ones who have been BMS or BHMS graduates, or from Ayush. This is something which I've been wanting to say for such a long time, that oncotherapy in this country, oncometabolism, oncology in this country, is something which is not just associated with modern medicine. It is also associated with Ayush, with Unani, and with multiple other specialities of allied medicine. Because I can tell you of a place in Kozhikode, which is in Kerala, where patients of cancer, post their operation, I repeat, post their operation. Suppose someone has a thyroid cancer, and you operate the thyroid gland, you remove the tumor, you remove the gland, you put the patient on chemo, and the patient is doing well. There's no recurrence, there's no metastasis. Now there's a center in Kozhikode which typically takes care of the post chemo side effects of these patients, tries to give them a better life. There's so many side effects that come with chemotherapy: peripheral neuropathy, hair loss, decreased appetite, nausea, vomiting. All of these are common side effects that we see with chemotherapy and radiation therapy. This center in Kozhikode, which is absolutely not a modern medicine center, it is an Ayush and Unani center. They try to bring in newer methods. They try to bring in the ancient methods uh, of healthcare, integrating it into modern medicine and trying to relieve the patient out of the disastrous side effects of the chemotherapy regimen. So they are never claiming, that that center is never claiming that we can cure cancer. They are saying that we are helping to have a better cancer-free life. That is exactly what we are trying to do. So the courses here are designed not just for the MBBS graduates, they're also designed for the BAMS, the BHMS, the Ayush graduates. Everyone gets to be equally a part of this. And there's no reason to think that, I mean, there are so many states like Maharashtra, there's so many states like Haryana, places like Chandigarh, some places in Agra, if I might say, some places in Pune as well, which are offering the Ayush doctors to perform even surgeries. So it's just about getting better at these areas. So maybe an Ayush doctor who's say practicing in Nagpur maybe and is wanting to do a surgery, wanting to know more about the steps and the procedures or the nitty gritties of, say, maybe a cholecystectomy, or maybe an ulcer debridement surgery, or maybe a transplant surgery or a graft surgery, would definitely get better, and would definitely get a platform from which he or she can build up, and then get into being into a place where not just their surgeries are going to be better, but even they will get that they'll have the finesse to work on. And with every course that you go through, with every course that you actually sail through, you would actually find that it's not just about lectures, it's not just about videos and content, it's also about evaluation. After every course video, there's an evaluation that is there, so that you are able to actively recall the things that you have studied. There's a PDF which comes along with every video, so that even if you're not able to listen to the video always, you can go through the PDF in real time, and you can keep scrolling and knowing the things which you would want to see. And this is the helpline number for the for the different inquiries and the QA sessions. And as I said, you are having a gift voucher and a special discount. So please talk to your counselor to get the special discount today. And that is all I would want to say regarding the courses of Mediversal. As you see, I have not spent much time in trying to promote or talk about any course. I would I would want to hear from you all what are the questions that you have. I have been seeing quite a number of. Any chance to associate with hands-on on weekend? Okay. Let us talk to each of the questions. Okay. I think I've already answered how this will help. Homeopaths are always looked down upon. That is in my observation. Okay. So again, I'm telling you, if you okay, I'll tell you about my state, West Bengal. I can tell you with a lot of belief. So I happen to be a respiratory medicine, doctor. I mean, I happen to be a medicine doctor, internal medicine doctor. Anyone with cold, cough, sore throat, none of these patients will come to me first. Trust me. They are always going to prefer homeopathy, and with all due respect to their beliefs. So one thing I'm telling you, there is a possibility that probably in the area where you are staying, Dr. Elizabeth, that's your name, I guess. Yeah. So in the area where you're staying, maybe that is the conventional belief. But once you start upskilling yourself, homeopathy with modern medicine or homeopathy with the concepts of modern medicine, I think you'll be able to counsel your patients even better. I think at the end of the day, it's all about how you convince your patients. It applies to me, it applies to you, it applies to everyone else. Yes, it is less celebrated as what the modern medicine branch is, but trust me, there's quite a number of people who would actually ignore modern medicine in most aspects, and consult a homeopath in the very first place, with all due respect. So that's perfectly okay. Okay. Integrated approach is essential. Yes. This is Dr. Bhagyesh. Yes, if I'm not wrong. Yeah. Yeah, absolutely. This is such a wonderful message. I have successfully managed difficult cases, including critical multivessel coronary artery disease, with Ayurvedic interventions, achieving encouraging clinical outcomes. Ayurveda contributes through its individualized, multi-target, and system-level approach. Absolutely. Integration enhances disease control, quality of life, and long-term prognosis, making healthcare outcomes truly more beautiful. That's why I am doing fellowship in cardiology in Mediversal. Thank you so much for sharing your experiences, Dr. Bhagesh. It's absolutely an honor. What is the validity of the certification across? Okay, So first of all, I'll just address two questions. Is it NMC approved? No, it's not NMC approved. It's not an NMC approved fellowship. It's an upskilling or a certification course which you can use in your CV. Yes, you can definitely use it in your CV, but you cannot be setting up your clinic as a cardiologist. For example, someone who's done a fellowship in cardiology cannot be calling himself a cardiologist just based on that degree from Mediversal, because it's not an NMC approved degree. So that is something which I'm going to be really, careful about. So do not absolutely consider this as NMC approved. Again, I'm repeating, it is just to upskill your current level of education. It's about bringing you all to a place where you start getting more confident in managing cases. So it is not something, it's not a degree that Mediversal is giving. So that is something which I want to clear. The validity, once you complete a course, the certificate that you receive, the advanced skill certificate that you receive, is valid lifelong. It is valid lifelong. So you can absolutely be using it as a part of your CV, definitely. Age criteria, upper age, I don't think there's any upper age. Absolutely not. That is the beauty of this field. I think there's no limit. Even a person who's as old as 90, hale and hearty, wanting to take up a course, please go for it. We are all in with you. Want to share something? Yes, Twinkle, I would bring you on mic. Just give me a minute. Can you share the list of hospitals? Yes. Vijay sir, can we share the list of hospitals, like, individually? Is that possible?
Yeah,
I think that is. Yeah.
I have got his number. We will do that.
Fantastic, fantastic. So the team will connect to you, Dr. Vishal. Any chance to associate with hands-on on weekend? This weekend, I'm not really sure, dear. But Dr. Vanika, I'm sorry if I'm pronouncing your name in a wrong way, Dr. Vanika. But there are going to be upcoming workshop sessions. We have already had a couple of workshop sessions, hands-on workshop sessions, which we have had in this year. More are definitely going to come. I mean, this is the year when we had our Bangalore office set up. So we also had our Dubai office set up. So a lot of things have been in the pipeline, and we are definitely wanting to get them done. And I'm very sure Vijay sir, Srinivas sir, and we all will be looking forward into conducting more hands-on sessions, more workshops. I have been planning an ABG workshop for quite a long time, assessment of ABGs, because that happens to be a really, really important tool when it comes to the OPDs and the emergencies, not OPD, sorry, the emergencies and the ICUs. So I've been planning to do it for quite a long time, and we have it in the upcoming weeks. So anytime we are launching something, we would definitely want you to stay in touch with the social media platforms where Mediversal is associated with, the Instagram, the Twitter handles. I mean, sorry, the Facebook handles, the Instagram handles, and you can always get an update of it. Uh, can I get clinical training in Pune if I join in this course? For a working professional, yes, absolutely. You are absolutely correct, Dr. Vanika. Whenever we'll have these workshops, we'll definitely have it in the weekend. That is something that we can assure you. That is something that we can assure you, because we know that you all are working at some place, or you have your families and other things to take care of. So definitely, Dr. Vanika, that's something that we'll definitely keep in mind. And I think that's something that we do as well. We usually have our webinars also on the weekends. I mean, if you can see, we usually have our webinars in the weekends as well. Just that today happens to be not a teaching webinar; it's more of an interactive webinar, which is why we kept it on this day. Um, any chance to okay, can I get clinical training in Pune? Yes, I think there's a list of hospitals around that region as well. Once you are in touch with Mediversal, and you're taking up a course, a certificate course, and completing it, you can obviously get in touch with one of the hospitals that we have associated in and around the region where you stay, not just Pune, any region that you are staying in. We have the list of hospitals which will be shared with you, and we can always, as I said, that you can add it to your CV, and Mediversal, being a partner of these hospitals with respect to these courses, will definitely give you an additional benefit in trying to know that yes, they would know that you come from an organization which has been trying to inculcate an upskilling, making you better, and that is in itself, I think, which is going to be very, very useful in the long run. Okay, Twinkle wants to have a talk, wants to share something. Yes, Twinkle, would you want to come on camera or microphone, like whichever you're comfortable with? Twinkle, I would love to have you here. You can unmute yourself, Twinkle.
Good evening, sir.
Good evening, Twinkle.
Yeah, I want to just share the experience that how I want to how we are getting benefit after touch with the Mediversal. I'm
Yeah.
working in the intensivist critical care unit as a senior intensivist in the Bombay hospital.
Okay.
2 3 days ago, I was attending one lecture on detailed basis of the sonography. I have one patient in the ICU. That 52-year-old male patient came with right hypochondriacism, pain, and complaint of primary Mediversal along with the hypotensions. So
Okay.
I immediately we have in-house facility to done a CT, MRA, everything. So we did a CT that called as a GIST. So we done immediately CT guided biopsy and all, and we stabilize. Now I want to share that how the knowledge is help to settle in the ICU, being a working in the ICU. There is a one complication was happened after 3 4 hours after post biopsy. Patient went into the severe hypotension. I
Hypotension, yeah.
use a machine of the sonography, and I just take a knowledge 2 days ago only on the sono machine, and I'm use a command like V mode and depth and everything what I collected from attending a lecture. And I just screening there is a bleeder from the biopsy side, and immediately we are called to the interventional team, and we are getting
Mm.
embolize them. So I just want to share that how the knowledge it help in an emergency cases also. If we have a good team and doctor works and with good platform like a Mediversal.
Thank
Thank you.
you. Thank you, Twinkle. Thank you so much. And for everyone hearing it, this is right from the horse's mouth, as we said. She's been an intensivist in one of the ICUs of a hospital in Bombay, and she's been sharing a case which is just 2 to 3 days old, as recent as it can get. And we had one of our webinars on USG, which was conducted by one of our esteemed faculty, and she says that the lecture, that the knowledge that she got from there helped her in saving a patient, which is in the ICU just a few days back. So so again, I mean, I really don't need to talk about what we are doing. Today was to bring all of you here. I think you can just say it's like a year-end meet. It would have been great if we would have physically met, because there's nothing better than that, and celebrating each other's journeys, listening to each other's journeys. So thank you, Twinkle, so much. Thank you so much. Any more questions? Okay, I have a question, which is no other question. I think I've replied to everything. Yeah. Any more questions? Any more questions coming up, please? Be glad to hear any more questions which come up. Any more questions coming up? Yes, I think we have a couple of questions. If I take radio as a subject, can I do in my hospital? Okay, this is Dr. Chand. Okay, so are you talking of radio, taking up radio as a Mediversal course? Is that what you mean? Taking up a course in radiology from Mediversal and then able to work as a radiologist? Is that what you're asking? If that is what you're asking, then yes, you can work. You cannot work as a radiologist, but you can definitely work as an intern in radio. You can definitely work as an observer in radio. You can also take up that skill to, you know, once you are clearing your NEET PG entrances, and if you really want to go into radiology, the skill that you will learn here will definitely help you. That is something which I can assure you, absolutely assure you. So when you join your residency, you will be at least a level above or a level ahead of your peers. That is something that I can always assure you of. Anything more? Any other questions? I'm absolutely free to take care of each of your doubts. It's about ultrasonography. Just joined. Is it about ultrasonography? Just joined. It's about ultrasonography. Yeah, it's about any courses that you take up. Any courses that you take up. I think we have a list of courses which will be shared to you by the Mediversal team in itself, and we'll be trying to we'll have our we'll have our counseling team which will get in touch with you based on whichever course you want to pursue. There are courses on ultrasound as well. There are courses on radiology as well. We are trying to integrate AI into healthcare as well, and trying to do that. Again, PG diploma. So any course that you are taking, I repeat, suppose you are taking a PG diploma in rheumatology. Can you set up a rheumatology clinic on yourself? No, you cannot, my dear. You cannot. What I'm trying to say is these are upskill certification courses. Once you take up, say, a PG diploma in rheumatology, what you can definitely do is with that existing amount of knowledge, and if you are just an MBBS graduate, or if you are just an MD internal medicine or a family medicine, you can have that as a part of your CV, and you can definitely start seeing, hospitals which will try to affiliate you into their department with respect to that CV that you have. So a hospital which is trying to say, suppose I am the HR of that hospital, I have a person, say X, who is an MBBS and an MD in family medicine. I have a person Y, which is you, which is MBBS, MD in family medicine, and a PG diploma in rheumatology, or say orthopedics. Once I have it, I know that you have the baseline idea and the knowledge of different orthopedic diseases that will be coming to the hospital. So I can affiliate you with the orthopedics team. But can you separately practice as an orthopedician? No, you can't. Can you do surgeries as an orthopedician? No, you can't. So that is something, that's why I said it is not a fellowship that is offered by the NMC. It is an advanced upskilling certification course by which you can add it to your CV, so that you get to be affiliated to those departments, so that you are able to see those cases. Can a homeopath? Wait just a minute, I just missed out on the question. If I join the hospital for general practice on basis of emergency medicine course knowledge, can I get a good salary? Okay, so first of all, you would definitely join if, in case I presume you are not an MD or a specialist in emergency medicine. So if you have completed your MBBS and you take up a course on emergency medicine from Mediversal, you reach out to the hospitals, any hospital, be it our partner hospitals or any hospital for that matter, you would definitely be considered ahead of any other MBBS graduate, but definitely you would not be considered ahead of an MD emergency medicine person. So your salary scale will be exactly based on the MBBS graduates only, but you would be given a preference in being given a job probably in emergency medicine, because you have the knowledge of how to deal with these emergencies. And that is exactly the kind of thing that I talked for rheumatology, that I okay, from BAMS again. So you will be put into that scale of salary of BAMS again. You would not be kept in the salary scale of an MBBS personnel. That is absolutely understandable. But for hospitals which are allowing BAMS to practice in them, which are allowing them the BAMS candidates to be a part of their hospitals, you would definitely be considered. Yes, that is definitely. The duration of this courses range either from 6 months to 1 year. The individual course team will definitely get in contact with you once you click on an interested course, or you send your details to the team. They will immediately get in contact with you. There's always going to be someone 24/7 who's going to get in contact with you. PG diploma versus fellowship in emergency medicine. PG diploma in emergency medicine, I think there's a difference in the duration of the course. That is number one. Number two, the content is a little more vast when it comes to PG diploma. Yes, the content is a little more vast when it comes to PG diploma. It's a longer course. I think it's a 1.5 year course, if I'm not very wrong. The team is going to definitely update you with respect to that. The details of the courses, I repeat, the details of the courses is what is going to be updated to you by the respective team as to how long that course is. But in general, a PG diploma course has a longer duration than a fellowship course. That's something that I can tell you. Any more questions?
Oh, a small announcement. Doctors, if you want to know more about our courses, please send I WhatsApp message to the number mentioned in the chat group. We will arrange a call back for you. And it would be great if you can mention your qualification also. The number is 9319927318. Just send a I message to that and we will get things started. Thank you.
Yeah, perfect. Do we have any other questions? Elizabeth, I think I've already answered your question, dear. I took your name as well when I was answering your question. Okay. Can a homeopath be eligible to practice with allopathy after upskilling with Mediversal?
Yeah, that's
Yes.
my question.
Yes. Yeah, Elizabeth. Again, if you are going to a hospital for work and if they're allowing homeopaths to be a part of that system, definitely yes. That applies to anyone. As I said, there are many states who are allowing Ayush to do surgeries as well. So in those states, the Ayush personnel will be allowed. Now coming to a state like say West Bengal, for example, because I come from West Bengal, where Ayush are not allowed to do surgeries in most major hospitals, then you can't be using this certification. You'll be using it in a place where the government is allowing Ayush to do surgeries or a homeopath to be a part of the courses. But one thing, there are so many homeopath based hospitals as well. Like in West Bengal also, I think we are having this in Kolkata. I'm not exactly remembering the name, but it is one of the premier institutes of homeopathy in India. You being associated with Mediversal and its courses is just going to give you an upskill when it comes to you being a part of that hospital. And I can just tell you the name of the hospital in a minute. Just give me a moment. It is so we have the National Institute of Homeopathy. We have the Birbhum Vivekananda Homeopathic Medicine, the Bardhaman Homeopathic Medical College. There are so many medical colleges of homeopathy where if you're a homeopath and you have an allied association with Mediversal, or you have an allied association with the upskilling courses that you have, trust me, even when you are going to be a faculty in these colleges, the fact that you have an association with modern medicine is going to really help you even get a chance to be ahead of your peers when it comes to appearing for a faculty position, or being a lecturer, or trying to deliver your content, or being a practitioner in these homeopathy medical colleges, for sure. That's for sure. Is that clear, Elizabeth? Yeah, thank you.
Yes, sir.
Okay. Can we work with hospital which is associated with Mediversal after completing the course? Absolutely. So once you complete your course, when you reach out to the partnered hospitals, you add this into your CV, you show the certificates. Based on their recruitment, you would always be given a preference compared to the other peers based on their requirements, based on their vacancies. They are absolutely going to give you an edge. That is something which I can definitely promise you, the content is definitely going to give you an edge when it comes to seeing patients there. Absolutely. Any further questions? I think Vijay Sir Srinivasa, I think what we can do is we can share with them the link which contains all the different courses, all the number of courses that we have, or we can even share them the website link. You can go to the website, and you can always take a look at all the courses that you have. There's a direct option of which asks you which course you are interested in. You can even click on that course, and there's definitely going to be a course counselor who will reach out to you. Yeah, as you can see, Vijay sir has put in the link of the website. You can go in there, and you'll get a detailed overview of the course, the duration of the course, how many lectures are there, what is the kind of certification that you will receive. Everything is basically mentioned under that course. The number of hours, and it's a very flexible course. I mean, I can tell you this, that since it's online, you have the facility of doing it at any point of time, managing your work, managing your personal life. You can absolutely enroll for that. So that is not going to be a problem, that you can absolutely take care of. Yeah. Anything else? Anything else that you would want to ask? Anything else that you would want to talk about? Yeah, that's a detailed link for the courses that Vijay sir has uploaded. I presume there are no questions from any other end, and I think I've answered all the questions that have been there. Vijay sir, Srinivas sir. Mm,
Cool, Dr. Guru. I think, yeah, the questions are all answered.
yeah,
And doctors, is the last chance for any one of you to ask anything. You can come on camera or you can unmute yourself. You can ask. Um, uh, I think doctor has took a very own time to answer all your questions in a very depth uh, at its best. Yeah, well, I think doctor will wind up. Thank you for so much.
perfect.
This is something a completely new kind of a webinar we had today. It was so interaction, and it was more like a podcast, something I might call it,
Yeah,
because
yeah.
yeah, because it was more like people coming in, talking their experiences, and we had so many questions, and lot of questions flowed in. Uh, so it was really a great session.
Thank you.
We always, and I want to tell one thing here, that we always thrive to do such webinars, and the engagement like this is what moves us, is what inspires us to make such webinars more and more and more. And on behalf of everyone, Doctor, here, I would really thank you from bottom of my heart.
Thank you.
And when it comes to Dr. Navonil Dutta, I would like to add one small point here. No matter what situation he is in, no matter what condition he is in, no matter where is he, we had sessions him joining from ICUs. We had sessions him joining from his consulting room, and it's been really tough for him, but somehow he makes it. That shows the kind of interest. That shows the kind of commitment to the community. So thank you so much, doctor.
Thank you. Thank you so
And
much. Thank you. Thank you.
your time,
Have
your
a
session, your words means the world to us, and to Mediversal, and to our doctors here. Thank
thank
you
you.
so much. Thank you so much. Thank you, doctors. Thank you so much. And a
Thank you.
small,
Thank you.
yeah, and a small announcement, doctors. This session is like more like a career counseling or career growth. So certificate will not be provided at this for this session. Thank you so much. Have a good night.
Thank you. Thank you to everyone. And I guess this is my last webinar for this year. I hope to see you all ahead in the upcoming months. So I wish you all a very, very warm, hearty greetings, lots of love, good health, prosperity, and I want you all to be very happy. Wish you all a very upcoming Merry Christmas and a very, very, very happy New Year. So, good wishes and love. Thank you. Thank you. Thank you so much. Good night.
Thank you. Bye bye. Good night. Good
Bye-bye.
night, doctors. It's been uh, this kind of support is what makes us do more webinars. We have a pretty busy webinar scheduled up for the December month. Watch out on our social medias for all the updates. Thank you. Good night. Thank you, doctor. Thank you for joining us. Thank you, everyone.
Thank you. Thank you.
Thank
Thank
you.
you so
Bye
much.
bye.
Bye-bye.